I'm a peer specialist. I'm going to start off basically with how I began. A peer specialist is an individual that works with a clinical team. I have lived experience, but I've developed a service to help people help themselves. How did I develop a service? Go back to the beginning 8 years ago when a group of individuals got together and they were looking, it was a pilot project and they wanted to hire a peer. And I had no concept of what a peer was. I kept asking everyone and everyone kept saying, well, I thought you would know. No, I never heard of it. I was too busy trying to get myself together. So originally I didn't get the job, and then after that I did end up getting the job, and I went to everyone and I said, "Okay, so can you guys teach me what to do?" And everyone kind of just stared at me and thought, "Well, you should know." There was nothing in place. There was no pen, there was no paper, there was no office, there was nothing. Nobody actually really truly knew what a peer was supposed to do. When I first attended my first staff meeting, I was kicked out of the staff meeting. And these were the same individuals that wanted to implement a peer. I was asked to leave the staff meeting. I didn't get through the front door. So when I went downstairs, the coordinators of the program took me back upstairs, and then I went and sat in the staff meeting, and everybody was appalled because how can she keep confidentiality? How can she keep this? How can she keep that? So I got over that, and then I realized I had to work. I needed a paycheck. And I don't think people really thought about that at the time, that I needed a job. So I was kind of caught in between. I had to figure out a way, like, how am I going to work? What am I supposed to do? So I sat down and I started to research the information that a group of other professionals, excuse me, came up with. Nobody would talk to me. They saw me when I started to introduce myself. People saw me as, and not to insult anyone, they saw me as a clinician. They said, what's different about you than the other clinicians? I was trying to explain it to them, and I thought to myself, okay, instead of explaining, I'm going to go. I flipped everything. I have this saying that I always say, I flip it if everything goes wrong. So flipping it meant, why don't you just ask people what they need, what they would like to have, opposed to kind of suggesting what they should have, right? And then I started to look at what was missing for me. Support was missing. My mother was a phenomenal support, but she's not a clinician. She only knew so much. So she only knew what a mother knew was to keep me going. So I started to ask people, and then from there, categories derived. I started to develop categories. People needed support, how to write, how to fill out applications, how to explain to their clinician, how to understand their clinician because the language was so different. It was just many things. Some people just needed support going out their front door for 10 minutes. Some people that were stuck in their apartment needed someone to visit them. So, saying that, I mean, I'm kind of jumping because I would say I'm going to go to another thing where I will explain what hindered me. What hindered me were the individuals that supposedly understood what recovery was supposed to be about and what a peer was supposed to be. It hindered me because they were offended by me. They were offended that a person with lived experience could think, and this sounds really crazy. They were offended by that. They were offended by the fact that I could say no to them. They found me very rude when I started to do my research and people started to pay attention to me. They found me extremely rude, condescending, because I could say no, and I could actually say, well, no, I don't think I'm supposed to work in this manner because peers are supposed to be more transparent, understanding. We're supposed to be there for the individuals. We're kind of caught in between the staff and the individuals. We're there to teach, help get the staff to understand what we are supposed to do as work, but we're caught in between because it's a catch-22. The staff also, if you reveal too much information, like doing a testimonial, and you also want to be seen as a professional, it's a catch-22 because then the people that are working with you cannot, how would you say, they're not your clinicians. They're supposed to become your colleagues. Okay, so therefore there's an idea that it's better to hire someone from outside and who is not followed within the service or the system. And then when I was hired, I think it was 11 months later, I went to do the certification. And lo and behold, the certification I thought was going to be bilingual. It was only in French. So that was another challenge for me. So I went to Quebec City. I threw up 2 times, excuse me if anyone's eating, in the class. And then they postponed my exam. And I thought, when I went back, I thought I was the only one who couldn't do that exam. And I realized people who were French had a hard time doing that exam. But I passed. I was the first English person to pass that exam. So I was all excited about it. Got back to Montreal and I sat there and I thought, well, the more things change, the more they stay the same. I still had to fight. I had to fight the professionals. I try to be very polite. Not always, it doesn't work. But I'm mainly, as a peer, I'm there to work with the individuals, which is contradictory to the way the system is developed. It's very contradictory because I try to give the individuals as much privacy and respect as I can, because for me, when I walk into a building, any building, I understand everyone has titles and I understand how the system works, I think a little better now. But for me, what I see are individuals and people and human beings. And when I went to a doctor's office, I wanted someone to say, hi, how are you? Opposed to, okay, 5 minutes looking at your watch, turning around, ignoring me. And so there was no reason for me to show up for my doctor appointments. That's how I felt. So I didn't want to repeat how I felt. I want to make sure that the individual is heard. And from there, that's how I created the service. I was also told throughout the whole thing that basically I wouldn't succeed. I'd be lucky if I had 2 people. So shall I just jump to what I do now? I developed that service, the service for the hospital. I'm a national peer leader of Quebec. I work with the Mental Health Commission to develop the practices and standards. I'm also on the committee developing a national certification for PSAC. We've developed a conference in Nova Scotia, which the certification is up and running in Nova Scotia. And I'm now a global leader. I studied in Boston University to become a global leader, with which we were the first group of peers to be accepted. And I wrote a lexicon, which will be coming out. It sounds weird to say that. And I'm also now asked to work internationally on a charter group. We're writing a charter with Larry Davidson, Anthony Stratford, and about 15 other countries. And there are 2 chosen from Canada, me from Quebec and another woman from Winnipeg, to help write a charter on practices and standards. And I think the difference is on peers. So if I jump backwards, this is only 8 years of work that I've put into it, and in the last 4 years it's exploded. Oh yes, and I've traveled to other countries, 3 other countries, to help implement peer services, because a lot of Brazil and Portugal, because they're starting to just develop paid peer work and peer titles and everything. But with all of that said, this is what we need to change in our thinking. I think a lot of it is verbal and not a lot of it is practical, and it hinders a lot of people, the way that we think. We need to step back and maybe look at the way that we present ourselves, maybe ask questions differently, maybe think differently, and maybe look at each other and look at people. Anyone at any time in life can get sick. I don't think we're born and it says that on our birth certificate that this person is going to have a mental health issue and that person is not going to have a mental health issue. It can happen any time in our lives. It can happen for any reason. It happens to people who are traumatized. I've worked as a peer for doctors who worked for 30 years who are devastated because 30 years they worked and they can't do the same thing now. Anyone can get sick. And if you step back and you look at yourself when you're helping someone, is it you that needs to be satisfied because you're giving that information, or are you actually listening and understanding and hearing what the person in front of you truly, really needs? And if you can collaborate, thank you, working with this individual, with the individuals that come and see you, I think your results would be better and they'd be a lot quicker and less fighting would go on. So I would like to thank you. I hope I was okay. Thanks.